You've heard us say it many times, there's no routine cancer. James expert Dr. David Cohn is here to tell us why that's so important.
Cancer is a really complex disease that involves the cancer itself, plus it involves the individual in whom the cancer arises. And a patient's genetics and the cancer's genetics really do influence the treatments that are recommended.
What if two people had the very same diagnosis? Wouldn't their cancers be the same?
Well, because there's no routine cancer, we've got to look at the individual cancer in that individual patient. The genetics of that cancer might be different. Even if it looks the same under the microscope, there could be changes in the DNA of that cancer that actually influences the treatment recommendations that are made.
Tell us about the strides made in the last 5 to 10 years.
There's been a lot of strides, and in fact, the rate of cancer death has decreased by about 26% over the last decade. This is mainly due to an improvement in treatments and also an improvement in early detection of many types of cancers.
Learn more at cancer.osu.edu/blog.